Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Today, we have two very special guests with us. If you've tuned in the past, you know Christine DiNoia. She usually is on these podcasts with us, and she's a registered nurse and an advisor on our clinical transformation team. Additionally, we have a special guest here to talk with us about Diabetes Awareness Month, since that is celebrated in November. So Christine, do you want to introduce Constantine, our guest?
Sure. Thanks, Laurel. It's great to be here again. And so to celebrate Diabetes Awareness Month, we wanted to take a focus really this month on prediabetes. And what we wanted to do was to invite a patient that has been diagnosed with prediabetes and how that person worked with their provider and their case manager. So we have Constantine, who is a 55-year-old patient that was diagnosed about 2 years as pre-diabetic. And as we go along today, I want to make sure that we include his thoughts and anything that he's learned from this process as well.
Hi, Christine.
Thank you for joining us today.
Glad to be here.
So we're very happy to have you here with us, Constantine. If you've been following the podcast for a while, you might have listened to our diabetes podcast last year. And if you haven't, I really recommend that you check that out. We kind of talk about the basics of diabetes and managing your large populations with diabetes. And while Christine and I were prepping for this podcast, I looked a lot into prediabetes. And one thing that I had never known was how prevalent it is in the United States. So a statistic that we ended up pulling from the American Diabetes Association actually said that 34.5% of the population has prediabetes. And just to put that into perspective, 10.5% of the population has diabetes. So it's a significantly higher number. And so one thing that we want to touch on today is ways and things that we should be concentrating on to prevent pre-diabetics from converting to diabetics. So Christine, could you tell us a little bit about the difference between diabetes and pre-diabetes?
Sure. So diabetes mellitus refers to a group of diseases that affects how your body uses blood sugar. And, glucose is vital to our health because it's an important source of energy for our cells that make up our muscles and tissues. And it's also our brain's main source of fuel. So there are many types of diabetes, as you know, and there can be type 1 diabetes, which is generally diagnosed in childhood. There's also type 2 diabetes, which is generally diagnosed later in life in your adult years and is potentially reversible with lifestyle changes. And then there's gestational diabetes, which can occur at times of pregnancy and usually resolves after the baby is delivered. So today what we wanted to focus on was prediabetes, and that means that you have a higher than normal blood sugar level. And it's not high enough to be considered type 2 diabetes yet, but without any lifestyle changes, adults and children with prediabetes are more likely to develop type 2 diabetes. So what I wanted to talk about a little bit, or to get Constantine's take, was, what was your experience when you were diagnosed with prediabetes? What were your thoughts when the doctor told you that you were considered pre-diabetic?
For me, it was kind of a wake-up call. I know it's kind of cliche, but it was, I just had to change. I had to make a change right away.
Great. And so when you worked with your provider and your case manager, what kind of tips and tricks did they give to you as to how you could manage your condition?
Basically, I had to change my eating habits. That was foremost number one. The other is come up with a plan of how I'm going to tackle this. And the other part is recording it just so I can stay focused and to see how my progress is.
So what kind of things did they encourage you to do besides changing your dietary habits? I'm sure that they gave you a referral to a dietitian or a nutritionist so you could talk through that. And then also, did they recommend that you check your blood sugars?
Absolutely. I actually was able to find a glucometer that I could actually connect it with my phone when I would check my sugar level morning and then also in the evening. And this particular program would actually store the information, what my sugar level would be. And the great thing about this program is I could share the readings with my doctor. All I had to do is actually just send it to him, and on a weekly basis, so he can to see how I'm progressing throughout the weeks.
That's awesome. So modern technology helped you out. So there was an app for your phone, and just like they say, there's an app for that.
Absolutely.
So it sounds like the app helped you to be able to monitor your progress.
Absolutely. It definitely kept me on track. The nice thing about it was I got to see the different variances of my blood sugar level throughout the weeks, and it didn't discourage me. It was just kind of like I knew that if I kept on doing as far as what my dietitian told me to do, as far as my eating habits, I knew those numbers would change, and I just kept on taking the readings and sticking with my diet. And the great thing about that is I can go, say a month or two later, I can go back into that data and look at how bad it was, and to compare where it was, from that point on as far as real time. And it was unbelievable how it went from one point to another, like within a matter of a short period of time.
So you were pretty motivated by seeing the results that you were seeing, your glucose numbers changing from day to day.
Absolutely. That just kept me focused on trying to be better, because I'm a little much of a competitor. So I wanted to beat this and not be labeled. So I stayed the course and stuck with what was prescribed to me.
Well, that's great. So it sounds like having the right tools available to you, the right people in support of you. So you had a dietitian, you had a care manager, you had your provider, and they were all supporting you on this process. So Laurel, I think that's a great point to bring up that Constantine made, is that, with the right support, this can be managed. So not only was the app and monitoring your glucose with the glucometer that you chose motivating for you, but also the lifestyle changes that you made, you saw a significant difference in your body and also in your activity levels as well.
Absolutely. Lost a good amount of weight, and my energy level actually was like I just didn't want to sit down. I wanted to do multiple things, and it was great compared to what it was before when I first got diagnosed with the pre-diabetic.
Great. That's pretty inspiring, Constantine. Thank you for sharing your story with us today, and hopefully it'll help other people who may be struggling with this new diagnosis of pre-diabetes and might be scared, thinking that they are definitely going to be diabetic, and then all of the things that come along with being diabetic, or as well as potential complications and having to be on medications for the rest of your life. So I really appreciate it, and thank you for your time today.
So after hearing all of that, and how many great resources are out there for people with prediabetes and even diabetes, one thing that I want to know more about is some of the barriers and how to overcome the barriers that might prevent people from getting help and potentially converting to diabetes. What I know is obviously there are a lot of great resources out there, tools that people with pre-diabetes can use to help monitor everything. But I do know that there are some large populations that might not have access or have social determinants of health that are preventing them from accessing those resources. I guess, Christine, what are some big barriers that you're seeing, and how do you think that we overcome that with our populations?
Sure. So Constantine was lucky in that he had the right resources available at his fingertips. So what we need to do is make sure that we can ensure that every patient has access to all of the right resources. And one way we can do that is to identify barriers. And one of the biggest items is social determinants of health. And so built right into the Lightbeam platform, we do have the Prepare Social Determinants of Health assessment form built in with links to Aunt Bertha, so that we can kind of assess what each patient's social determinants of health are. And it helps us guide and direct the care managers in the direction that they need to for each particular patient.
So while I was doing some research, Christine, I found that Americans with diabetes actually have 2.3 times higher healthcare costs than those without diabetes, which is staggering statistic.
Yeah, those are staggering statistics, Laurel, and certainly Lightbeam can assist organizations with creating cohorts of patients so that we can identify those patients that seem to be trending in that direction. And we need to keep our focus on keeping the healthy instead of focusing on the people that are already sick. In this instance, the amount of healthcare revenue that we could save by focusing on this pre-diabetic group versus already into the diabetes group could be staggering as well if we can look at the 2.3 times greater healthcare cost. So very important and shouldn't be overlooked. And of course, we need to look at the diabetics as well, so that we can help manage their conditions and help prevent them from converting higher into diabetes or having any of the complications related to diabetes, such as cardiac conditions or kidney conditions or things like that. So we really want to keep them managed well so that they reduce their healthcare costs as well.
If you're looking for additional resources on diabetes, you can check out our podcast on that topic, and we'll have it linked down below as well. Additionally, if our resources don't cover anything, feel free to reach out to us at lightbeamhealth.com. Thank you again, Christine and Constantine.
Thanks, Laurel.
Thanks, Laurel.